necrosis, the immune cells, the white blood cells, are affected by vitamin D. In patients who are vitamin D deficient, there's an excess of a chemical released from white blood cells that causes inflammation and clotting. And it has to do with the interferon, tumor necrosis factor, interleukin-6, and others. Now, when you take vitamin D, it actually helps the immune cells work properly and not cause so much inflammation. So vitamin D helps reduce inflammation, which actually reduces cholesterol. And so administration of vitamin D in those who are deficient increases good cholesterol, it decreases triglycerides and bad cholesterol, it suppresses renin and other chemicals that lead to hypertension. So, you know, they're finding all kinds of things. Vitamin D is more of a hormone than a vitamin. It takes care of a lot of different hormonal activities and modulates our immune system. And when our immune system's out of whack, you know, we have a lot more inflammation. So, and a lot more heart disease, believe it or not. Now, vitamin K2 and D3, studies show that vitamin K2 helps prevent heart disease and blood vessel disease, as it directs calcium that vitamin D3 helps us absorb and go to the bones in our skeleton, and it helps it not accumulate in the blood vessels. So it reverses hardening of the arteries, which causes heart disease. Okay? So they're finding healthy levels of vitamin D3 help the immune system remove bacterial infections from the blood vessels and deep tissue. Coumadin actually stops that from happening and stops the vitamin K2 from working properly. So when your docs give you Coumadin, it lowers your levels of vitamin K and affects your vitamin D and accelerates heart disease. Even though they're trying to stop blood clotting, they actually accelerate your death. Interesting. So, the reactions in the body, vitamin K is essential for all the reactions for blood clotting. And warfarin, or Coumadin, works by decreasing the activity of vitamin K, lengthening the time it takes for a clot to form. It also, you know, decreases the vascular integrity. That's why people on Coumadin get these bleeds into their skin, you know, and it affects, it's a poison to the liver. K1, found in green leafy vegetables, goes directly to your liver, helps you maintain healthy blood clotting system. This is the kind of vitamin K that infants are given at birth. You know, they give babies a shot of vitamin K to prevent serious bleeds. It is also vitamin K1 that helps you keep your own blood vessels from calcifying, helps your bones retain the calcium and develop right crystalline structure. Now, when they give you things like, well, the different things to make you have stronger bones, you know, they're putting people on these different drugs that actually makes a different crystalline structure, and they found it actually is more brittle, and you're more likely to break your bones. Even though they look better on x-rays and they got more calcium on x-rays, it's the wrong matrix. Whereas if you take vitamin K and vitamin D3, it makes the right matrix in your bones. K2, good bacteria in your intestines take and convert K1 into K2. Now, K2 is in high quantities in a healthy gut, but most of us don't have a healthy gut. And it's not well absorbed, and it passes out in our stool. The K2 protects the blood vessel walls, the bones, and the tissues. It's present in fermented foods in higher quantities, particularly cheese. Sharp cheese has vitamin K2, believe it or not. And Japanese food natto, which is by far the richest source of K2. So, kind of interesting little factoids. So if your bacteria in your gut aren't right, you don't convert as much K1 into K2, and K2 is more powerful in our bodies.
The
Yes.
nattokinase, is that part of that natto thing?
Natto has nattokinase also. It's another substance. Now the healthy liver takes vitamin D1, which is made in our skin from the reaction of cholesterol and sunlight into D1 and makes D2 ergocalciferol, and it's converted into the kidneys into calcitriol, the biological active form of D3. And it circulates as a hormone in the blood, regulating concentrate of calcium and phosphate in the bloodstream, promoting the healthy growth and remodeling of bone. Now, it also affects neuromuscular and immune function, and it modulates that and helps us get rid of atypical infections. So, what is arteritis vasculitis? Arteries, when they are inflamed, they have a condition called arteritis. The veins and lymphatic vessels develop a vasculitis when they become inflamed. Now, when we're lacking D3 and K2, they get inflamed easier. And it caused, arteritis vasculitis can cause partial or complete blockage of the blood vessels, narrowing blood vessels, weakening of the walls of the blood vessels, known as aneurysms. Blood clots are common because whenever you've got inflammation, blood clotting factors will sense there's some sort of bad thing going on, and they can form blood clots, especially when there's mycoplasma, chlamydia, or ureaplasma infections present. A lot of docs are testing what they call C-reactive proteins, which are an indication of atypical bacterial infections, particularly cardio C-reactive protein, which they found indicates there's infection in the blood vessels in the heart. Okay, there we go. Now, one of the things I've found over the years is we've been having increasing infections with these atypical bacteria. And they're not transmitted very easily. You have to have direct droplet respiration. In other words, somebody coughing with this bug next to you and a droplet gets into your body because it can't survive on the counters or different things. It's transmitted through bodily fluids like sex or breathing in the molecules or kissing or genital oral contact. And the first stage in these infections is usually bronchial or intestinal infection, and fatigue, malaise, muscle aches, joint pain, headache, skin, fever, and weight loss. What I found was these infections actually started becoming very common, especially when you get the crisscrossing of the jets going on and the vapors coming down. As soon as the vapors would hit, called chemtrails, and people would breathe this in, you'd start getting this first stage of infection, which was fascinating to me because, you know, I didn't really believe in chemtrails, and I started seeing these things first when I was practicing up in Cedar City, Utah, and I found a lot of people would come in within days of having this crisscrossing in the sky, and they'd have bronchial infections, sinus infections, abdominal discomfort, you know, joint pain, headaches, muscle aches, skin rash, all kinds of stuff. And I would test with kinesiology, and it was atypical bacteria being dropped on us from the sky. And I found that has consistently been the case, and they're even including viruses inside of these bacteria now. And so we're getting chemical and biological warfare done on the American people, which if you don't believe it's happening, go and read some of this stuff on the internet. It's quite fascinating. The second stage is known as the vascular inflammatory stage, which may cause pain in the extremities and joints, arm numbness, blurry or double vision. I get a lot of people in with these symptoms. Headaches, shortness of breath, high blood pressure. I mean, think about it. This is generating a lot of traffic to go through our ERs, our doctor's offices, our hospitals. Occasionally, the first and second stage symptoms can occur together. Definitely demonstrates an infectious cause with additional bugs, either fungus, virus, atypical bacteria, and a lot of people getting blood clots. I had my first blood clot when I was driving up to Salt Lake City 8 years ago. And let me tell you, that was not fun. It occurred in my popliteal vessel in my back of my knee. It hurt like hell. I could feel it, and I tested. Oh, geez, I've got a blood clot. So the first thing I did was I treated myself with nattokinase and serrapeptase, which is these things right over here. And this dissolves internal blood clots and internal scarring, and it actually can make repairs in the blood vessels. But anyway, I was able to treat that, but I still didn't feel right. And so what I came to find was I had high blood pressure. And here, my heart had healed, and yet I was getting this stuff that was hitting my heart. So I continued taking the nattokinase serrapeptase, and it made my heart feel better, it made my blood vessels feel better, and I wouldn't get blood clots as long as I was taking this. Now, the other thing that I figured out was that omega-3s worked really good. Salmon oil is an omega-3 fish oil. And the reason I like salmon oil is because it's got another thing in it called astaxanthin. And astaxanthin, actually, you'll notice salmon oil doesn't go rancid as fast as other fish oils. And I wondered, well, why is that? And it's because it's got astaxanthin in that kills bad bacteria. So salmon oil ends up being the best fish oil for reducing the inflammation and problem within the arteries. Now, the other thing I found was vitamin E was essential, and I can't find our vitamin E. It used to be down there and it got moved. But anyway, vitamin E in the dose of 1,200 units every day with the fish oil keeps you from forming bad blood clots. And my mom's been taking it since she was getting blood clots from taking Premarin. And so the doctor put her on Coumadin because he wanted to keep taking the Premarin, and her liver started failing from the Coumadin. And so I took her off the Coumadin, put her on the fish oil and the vitamin E, and I put her on the regular fish oil and vitamin E, and she hasn't had a blood clot since, which has been way cool. And she's not taking the nattokinase and serrapeptase. She just takes the fish oil and the vitamin E, and she's been fine. And she was here yesterday, and her mind was totally back. It was interesting. I was giving her Prevagen for her Alzheimer's. Prevagen and Amloban. And yesterday, she had accumulated 5 bottles of the Prevagen on top of her fridge. And so I stole 2 back because I figured I better rotate these, because she's not taking it. Well, it's so interesting. Yesterday she came in and she's been mad at me since I took her Prevagen away from her. And what's interesting, she remembered that I did it, and she was smart enough to make me feel guilty so I'd give it back to her. So she's doing actually quite well. She's got her memory back, and she's got her ability to make her son feel guilty again. So this is interesting because she hasn't made me feel guilty in years. So anyway, the reason I bring that up is, she's 83 years old, and our family has a history of heart disease. And she's 83 years old. She has no sign of heart disease. And she's been taking the stuff I've been giving her, and, over the years. She got a little Alzheimer's, and we got rid of that, which was fungus in the brain. She had a chocolate addiction and had to have the Hershey's candy bar every day. And that's what caused her Alzheimer's, in my opinion. All the sugar, which created feed for fungus. The fungus got in her brain, caused Alzheimer's, but we got rid of the Alzheimer's using antifungals and the Amloban and lion's mane, those kind of things.
Also has MSG in it, those Hershey.
Oh, yeah.
The chocolate?
Yeah, the chocolate.
Did she give it up?
She still sneaks a little bit in every now and then when she can remember. So, but she's remembering more often, so I'll bet she's back on the chocolate.
What about the Amberlin that has the no sugar in it, but has the other?
Chocolate has high antioxidant content, and without the milk sugars and all the additives, is actually really good for your body. And it's high in magnesium, things that actually help the body. So, you know, I'm not against chocolate, I'm just against chocolate that's been processed and isn't good for you. But there's a lot of good chocolates out there. Okay, so in the third stage, you get the hardening of the arteries, you get the infection that comes up, and it can actually, the infection can spread to your other organs and cause failure of your organs. You know, right now, kidneys are being affected hugely here in the United States. We've got the highest amount of people on kidney dialysis of any country in the world. And we're also, you know, one of the richest countries in the world, so we can afford to have a lot of people on kidney dialysis. But it is really, it's amazing to me how many people are on, have had failure of their kidneys, livers, you know, different things. And, you know, we're doing transplants, we're doing a lot of different things because we're rich enough we can, but you know, Obamacare and the different things that are coming is going to restrict the amount of those procedures. But anyway, arthritis vasculitis is the thing that causes this. Now, about, it's been 5 years ago, a woman called me up saying that her husband was dying. And she wondered if I could do anything, and she said she'd pay whatever it took to get him healthy and feeling better again, because, you know, they had a lot of money and they'd been to a lot of doctors, and they said there was nothing they could do, and he was laying in bed dying. And she said, will you please find something that will make my husband better? So I intuited into his body. I got that he had arthritis, vasculitis. It was killing his organs, and he was dying. And so I came up with this treatment plan and had him take nattokinase, a capsule in the morning, a capsule in the evening in bed, and then serapeptase, 20,000 units, a capsule in the morning, a capsule in the evening, a capsule at bed. And what this did was it dissolves internal scarring and tissue damage, so it helps the organs that are shutting down even. Helps them get, now this atypical bacteria can hide in fungus and act like a virus. So I intuited that I needed to treat him. I told him 2 years, 24 months. And I told him he'd probably be better at the end of the 2 years, but it might take 2 years. Well, it was quite interesting. We put him on the number 3 Bactrex, which treats bacterial infections. We put him on the number 4 FungDX. We put him on the number 5 stabilizer and the VIVI, and gave them to him several times a day. And also, I was told to give him different fruit complexes of berries and such, because they help rid the body of the atypical virus and bacteria. Grapeseed extract, 100 milligrams, a capsule 3 times a day to help repair his blood vessels and his organs. Grapeseed extract, I started dealing with a lot of that with people with fibromyalgia, chronic fatigue syndrome, and it would help them. But I intuited he needed this. Also that he should take vitamin K, D and K2, and I actually didn't, this product wasn't out at that time, so I used regular vitamin D, D3 and vitamin K2. We put him on L-citrulline, which is an amino acid that helps with repair of the blood vessels in the organs. Resveratrol, which is considered a superfood, and I put him on 200 milligrams, but I found later that, you know, if you can afford it, 1,000 milligrams helps repair your DNA and repair all kinds of stuff. And it helps get rid of atypical bacteria and virus. The other thing I put him on was magnesium, 200 milligrams in the morning and 400 milligrams at night, and magnesium citrate tested the best. And that citrate helps bring the magnesium into the cells better. And so we put him on that, and it exchanged the calcium deposits and made them softened. Magnesium is the great softener. You know, if you're having hard stools even, magnesium will soften them. If you have hardening of the arteries, magnesium will help soften them. Vitamin C with bioflavonoids in a 500 milligram